Hey guys, welcome back for another week of Work It Out Wednesdays. On Wednesdays we work out a practice question, but all month long, we've been covering our practice question series. And today we will be continuing with this week. We have been covering women's health, STDs, pediatrics, and non clinical content. I always give my disclaimer on my videos. Hey, y'all. Hey, I'm Dr. Brittany Weinstock, a family nurse practitioner and founder and CEO of the Nursing Studio. Y'all know I do my videos for nurses and nurse practitioners to aid and assist you with your exams, boards, and practice, right? And I have to go over this because guidelines change on various things. So the questions and things that I gauge my review materials for, what the current test is testing you on those particular guidelines. Sometimes they're not with the current guidelines that we are actually utilizing in practice because tests have to be updated and it takes time. So when I'm teaching you for practice purposes, I say that specifically. But for exams and boards, I tell you based off of what they are currently testing you on so that you can be successful in that fashion. I always tell you guys, there's no absolute medicines and we cover patients on a patient by patient basis. So use this information as such, okay? All right, let's get into the questions. Question number 1 states, the nurse practitioner and nurse practitioner student are discussing cervical cytology and at the age that it should be started and how often. What shows appropriate understanding? Is it A, cervical cytology should start at age 20 and should be completed every 2 years? B, cervical cytology should be from ages 21 to 29 and completed every 3 years? C, cervical cytology should be from ages 21 to 29 and completed every 2 years? Or D, cervical cytology should be completed every 2 years once sexually active? Take a moment to tell me what you got in the comments. All right, you guys, I always tell you to read the stem of the question first to ensure that you are answering what they're truly asking you, right? So the stem of the question states, what shows appropriate understanding? So what are we even talking about here, right? So they're talking about cervical cytology, what age it should be started, and how often should it be completed. So here you just have to strictly know this, and things have changed. The answer here is B. Cervical cytology should be from ages 21 to 29 and completed every 3 years. I know at one point we started earlier than that. At one point it was whenever they're sexually active. That is not how the guidelines go. You start at age 21, regardless when they became sexually active. 21 is the age that they say started regardless. We do it from 21 to 29 every 3 years. I know at one point we're doing it annually. It's every 3 if they don't have any abnormalities or risk factors. If they have had previous abnormal testing, you want to do it every year, just like we do with anything else, right? Now, what happens after 29? So the people who are from women from 30 to 65, we have options, right? So you can do the cervical cytology every 3 years, or they can opt for the HRHPV every 5, or you can choose to do both of those every 5 years if they don't have risk factors and abnormalities. And then once they are 65 years of age and older, and they don't have any abnormalities or risk factors, then they don't warrant any further assessment. Okay. Question number 2, a patient presents to the office with complaints of discharge. The nurse practitioner is assessing the patient and notes a strawberry cervix. Based on these findings, how should the nurse practitioner, it should say diagnose, but because I messed up and put treat, tell me how you would diagnose it and tell me how you would treat as a bonus. So is it A, bacterial vaginosis, B, trichomonas, C, chlamydia, or D, gonorrhea? Tell me what you think in the comments. So again, similar question states, based on these findings, how should the nurse practitioner diagnose and bonus treat that diagnosis? So patient comes in complaining of discharge. Nurse practitioner assesses the female, notices a strawberry cervix. Y'all know I always tell y'all know those key identifiers. And you should know B, trichomonas. Strawberry cervix should make you think instantly about trick. With bacterial vaginosis, the fishy odor is that common identifier. Gonorrhea, you have that. They can present with that green discharge. So when you see those key things, you need to quickly be able to go to that. And then, how do we treat trichomonas? Should be with flagyl. All right, question number 3. The nurse practitioner and nurse practitioner student are preparing for an upcoming well child appointment, and the nurse practitioner student is inquiring at what age should you initiate the Snelling exam? What age is the appropriate answer? Is it A, 4 years old, B, 2 years old, C, 6 years old, or D, 3 years old? Tell me what you got in the comments. All right, so the stem of the question states, what age is the appropriate answer? So we're looking to see what age should you initiate the Snellen exam. So we know the Snellen exam is the vision test, right? And there's various formats of the visual acuity test uh, because the little kiddos can't can't read, so they may not be, at a certain age, so they may not be able to say the letters. So they also have it in like the shapes with the heart, the star, the ship, all that stuff. But what age do you want to start that visual acuity? And the answer is D, 3 years of age. And at sidebar, at 6 years of age, they should have a 20/20 vision. But at 3 years of age, you're trying to test that acuity. You can start as early, and some of them you can use that actual chart with the letters if they are reading. We progress to that, with the reading age. But again, we start doing that visual acuity test at the age of 3. And then lastly, the nurse practitioner is explaining ethical and legal terms to the NP student. They are discussing the term that means to do no harm. What term below goes with this definition? Is it A, justice, B, veracity, C, beneficent, or D, non-maleficent? All right, tell me what you have. Okay, stem of the question states, what term below goes with this definition? And the definition is to do no harm. We know A, justice. Nope, that means fair. B, veracity. We know that means truth. C, beneficent is to do good. Beneficial, right? Benefit, to do good for you. D, non-maleficence. I say think of non-malice, like no bad things. So to do no harm is D, non-maleficence. And I beat that like a dead horse, over and over and over to ingrain it in your mind that when we're doing non-clinical content, make sure you're reviewing those terms because repetition is the key to retention, right? Repetition is the key to retention. So make sure that you are going over those things. I hope y'all found this helpful. As always, y'all, please like, comment, and subscribe and share with whomever you may think that may find this beneficial as well. I thank you guys for all of the recent subscriptions. That helps my business and the things for me putting this out here. It puts it out for more students. I get so many universities reaching out that I work with where students are struggling. So I like to kind of give that because I know things cost money and you're already trying to make it out here. Life and everything and the expenses are crazy. So I try to give you the tools for free. So this helps me on my end too. So I appreciate y'all. Thank you, thank you, thank you. But again, if you haven't subscribed so you don't miss any of my upcoming things, I have some more stuff upcoming, some exciting things that I can't wait to share with you guys as well. But I'm not going to hold you any longer. But make sure y'all meet me back here tomorrow because we have some more practice questions. Bye, y'all.